Over at Gundersen Health System, the students in the Wisconsin Academy for Rural Medicine get some hands-on medical training today. News 19's Bowen Kidrovich taking a look at how these students are preparing to better serve rural communities.
Future physicians from the WARM program are getting familiar with a wide variety of medical equipment and procedures that will help serve rural communities.
A lot of times when you're doing medical procedures in a rural area, you have to be ready for anything because you may not have all the resources that you would have in a larger city area. If anything kind of takes a turn that you weren't expecting, you have to be ready.
You really have to learn to be a jack of all trades because the lack of access is a big issue. In a clinic setting, you have to be able to, kind of deal with whatever walks in the door.
Students practiced on dummy models, performing chest tube insertions and joint injections. Technical skills with ultrasounds and diagnosing infectious diseases, with some experiencing the procedures for the first time.
We've had some hands-on training throughout our phase 1 careers and curriculum, like CPR, but when it comes to this kind of training, whether it's lumbar punctures, suture skills, airway management, I would say this is really the first time that we've had some true intensive hands-on training.
Dr. Lansing says the WARM program was created to help combat the shortage of doctors Wisconsin is experiencing.
We have a situation right now where almost half of the physician workforce is going to be retiring within the next decade, and we've got to fill those gaps. And so we're trying to recruit people into the medical field that are more likely to go to some of our smaller towns and more rural areas in Wisconsin.
Students like Madeline are looking to close that gap.
I'm originally from southeast Wisconsin, from a small community. I grew up with a lack of access to healthcare, and I didn't really realize that until later when I lived in, Madison and even here in La Crosse. So I knew that I wanted to be someone who could provide that kind of care in the future to communities that needed it.
Reporting from La Crosse, this is Bowen Kidrovich, News 19.
And the WARM program is equivalent to traditional medical training, as it also takes 4 years to complete.